Hey there, this is a video about the general mnemonics which we use in every case on the Step 2 clinical skills exam. Let's begin. The first and the second things that you do on the exam is HPI, that is History of Present Illness, and ROS, Review of Symptoms, which I am going to tell you later. Then we followed the mnemonic PAMHUGFOSS, which is Pam Hug Foss. Let's see what this is. P is for past history. A is for allergies. M is for medications. H is for hospitalizations. Or previous surgeries. U is for urinary symptoms or complaints. So you can ask the patient, do you have any urinary complaints? And this is for GI complaints. So in GI complaints, you can ask about nausea, vomiting, belly pain, constipation, or diarrhea. F is for F is for family history. O is for occupation. S is for sexual history, and S is for social history. And what I do is I also take screening here with all the rest of the S's. So in screening, you can ask about PMDC, PAP for a woman who is young, mammography for any woman who is more than equal to 40 years age, DEXA scan for any person who's above 65 years, and colonoscopy for anyone who is more than 50 years. So this is it, guys. This is the general thing that we do for every case on the clinical skills exam. This is very simple. Just in case you want to do a domestic violence screening, for the domestic violence screening, the mnemonic is very easy to remember, and the mnemonic is SAFEGARD. This is the mnemonic. So S is, do you feel safe at home? A is, are you afraid of anyone at home? If it's an elderly patient, it can be his son, or if it's a woman, are you afraid of your boyfriend or your husband? And AF stands for afraid of anyone, or does anyone in your family know about it? E is, do you have an emergency exit plan? G is for, do you have a gun at home? Is your whoever is taking care of that person, if it's an elderly, or if it's you're asking it to a girl, then it can be her partner. Is your partner alcoholic? How is your relationship with others? How is the relationship of your partner or your son or daughter with others? Relationship of your, so the person whom you suspect is abusing your patient with others. And the last one, do you feel depressed? Okay, so here you go, guys. This is the mnemonic. As you can see, the history of present illness, the review of symptoms, and palm hug force, and then domestic violence, it is safeguard. Okay, now we are going to quickly see what are you going to type for this. So for history of present illness, you're going to type HPI, and for review of symptoms, it's going to be review of symptoms. And then for past medical history, you can write past medical history, and for past surgical history, you can write past surgical history. If you don't have anything significant to write in this, then you can write PMH/PSH is non-contributory. Okay, and then for sexual or social history, you can just mention SH, and if it's a female patient, you can mention the sexual history under OBGYN. Okay, and that is for domestic violence. Now let's just quickly go over the mnemonics for review of symptoms. So for review of symptoms, the mnemonic is THENFRCS PUB. First, let's do this. So T stands for trauma or travel. For H, it's headache. So with headache, you can ask changes in vision, speech, stroke, or you can even ask WNT, which is weakness, numbness, and tingling. You can do remember this weakness, numbness, and tingling. WNT mnemonic, it comes up in any neuro or a joint pain or a limb pain case. E is edema, but I also take it for endocrine. Especially if you have to ask about thyroid, then you have to ask about cold intolerance, any hair or skin changes. This is the triad that you ask for endocrine. And then for N, you have nausea or vomiting, which is also covered in the palm hug force mnemonic under GI complaints here. Then you have fever, chills, night sweats. Okay? And then you have racing of the heart. And do remember to ask about chest pain when you do that. And rash. So you can follow this way. Do you have any fever, chills, night sweats, or rash? Or do you have racing of the head, chest pain? You can go this way. Racing of the heart or chest pain. And then the C follows. That is, do you have cough, sore throat, runny nose, or shortness of breath. So with C, you can cover CVS and respiratory. Okay? This stands for shortness of breath, sore throat. So this is what it is. CVS and respiratory are covered under CNS. It's another easy way to remember that. And pain. Do you have pain in your belly, which is already covered under G of Pam Hug Foss? And the most important thing that you have to remember is pain in your joints. Then do you have urinary complaints? If they say yes, then you ask about the other urinary symptoms like burning, a color, does it smell, do you have straining or dribbling? And we are going to see that when we do urinary system. B is for bowel habit, which is covered. So you can exclude these three. Just remember pain in your joints for P. Okay, so these are the main things. Now, apart from review of symptoms, right here after screening, what I like to do is I would like to add another S right here. Excuse me. Another S right here would stand for sleep, appetite changes, weight changes. And when the patient says that she has lost weight, you ask if the loss in weight is intentional. And then you ask diet, exercise. And if it's a young patient, you take immunizations. Okay? You can also ask here for infections. So that's it, guys. This is the mnemonic. To review, Pam Hug Foss, and with S there's another S, that is sleep, appetite, weight changes, diet, exercise, and immunization. And then you have the mnemonic for screening of domestic violence. And then you have review of symptoms. We don't have to use the entire ROS mnemonics for every case since we have to take a focused history and save time. Those specific ROS mnemonics for pertinent negatives will be shared in my upcoming videos. I've attached screenshot for your revision, so good luck and thanks for watching.